name is Haley. Today, my mom is bringing me in for surgery at Essentia Health Duluth, the Miller-Dwan building. You can follow along, so if you ever need surgery, you'll know exactly what to expect. The first thing we do is ride the elevator to the 5th floor and let them know we're here. After answering a few questions, I get a bracelet with my name and birthday on it, so everyone knows who I am. Today, I'm kind of a big deal. In this room, a nurse will check my vitals. That's fancy hospital talk for making sure I'm ready for surgery. First, she'll check my blood pressure with a machine that gives my arm a little squeeze. This special little clip is called a pulse oximeter. It goes on your finger and lets the nurse know how well you're breathing. Then she checks my temperature and my height and weight. Now we're heading to the coolest room in the entire hospital. This room. And on surgery day, it's my room. Look at me, Mom!
Oh, those are super cute. Let me see.
Before we get started, I get to change into these cool hospital pajamas. Today, mine have puppies on them. In my room, I get to meet a lot of new people. This nurse asks me and my mom important questions. She makes sure I have not eaten or had anything to drink this morning. She puts all of our answers into the computer. Next, I meet a child life specialist. She tells us all about what's going to happen today. She answers our questions, shows me pictures, and lets me touch some of the medical equipment. This stuff is really cool. This is like the mask I'll wear in surgery to help me fall asleep. She even lets me pick out a yummy smelling lip balm that we rub inside the mask to help the mask smell better. If I was a little older, the doctors might want me to get the sleepy medicine through an IV. An IV is a poke that leaves a tiny straw in my vein. It kind of feels like a pinch when it goes in. Sometimes you have to wait a little bit to go into surgery. Luckily, there are lots of fun things to do while you wait. You can color, watch TV, or go into the playroom. Now, we're upstairs in the surgery waiting area. This is where I meet with my doctor. He makes sure we don't have any questions before we go into surgery. Next, I meet with my very own surgery nurse. She will be right by my side during surgery today. She checks my name band to make sure I'm me and asks my mom and I more important questions. Now, we meet my anesthesiologist. He is a doctor that will give me the sleepy medicine. He uses a stethoscope to listen to my heart. And he has me open my mouth real wide to make sure I'm looking good for surgery. I'm not really tired right now, but my anesthesiologist tells me all about the special mask that will help me fall asleep when it's time for surgery. In case you have to wait a while to go into surgery, there's another playroom here that's super fun. If I was older than 10, I would have to wait in a different area called pre-op. There are more nurses and doctors here just waiting to meet me. I was nervous about going into surgery alone, so I asked my doctor and my anesthesiologist if my mom could come into the operating room with me. They said yes. You can ask your doctor and anesthesiologist if your mom or dad can come back into surgery with you too.
3, 2, 1. Ta-da!
But first, she had to put on a bunny suit so she doesn't bring germs into surgery. Mom looks funny. I wish I could take a picture. When it's time for surgery, my nurse will walk my mom and I back into the surgery room. She helps me up on the bed and gets me ready. Everyone's wearing hospital clothes, hats, and masks to make sure everything stays clean. It makes me feel better knowing my nurse will be right by my side during surgery. My surgery team puts stickers on my chest and belly that listen to my heart. Then they put the pulse oximeter on my finger. That lets them know how I'm breathing. Now, the anesthesiologist lets me put my lip balm on my mask, and shows me one more time how the sleepy medicine works with the mask. And once I'm ready, they put the mask on me, and I start to get very sleepy. And just like that, surgery is over, and I wake up in the recovery room. There are a lot of computers in the room, and even other people who just had surgery. I still have the stickers on, and I will still have an IV in my arm. Remember, this is a small straw to help give you medicine. If you're not feeling good after surgery, it's okay to tell the nurse. She might be able to give you something to help make you feel better. After just a little bit of time in the recovery room, my nurse gives me a ride on my bed back to my room where my mom is waiting for me. Then I can have some juice or even a popsicle if I want. Some kids have to spend the night after surgery. If you do, you will stay at St. Mary's Children's Hospital. It's in a different building, but it's connected using special hallways called skywalks. My nurse says I get to go home today. She lets me pick out a stuffed animal and then gives me a ride in my wheelchair to my car. Well, that's it. That's all there is to having surgery at Essentia Health Duluth. Thanks for coming with me today. Bye!